pleasure to hold the panel discussion on behalf of the Astron College, an e-learning platform of the Astron Institute of International Studies. Our today's theme is Nursing Quality Management, which happens to be the core of the healthcare quality delivery in any organization. A lot has been spoken about healthcare quality, but we need to understand that the quality goals cannot be achieved until the heart and soul, our nursing practices and our nursing services are brought into the quality ambit. As we focus on this special field, I have the pleasure to welcome our super speakers of today, Colonel Binu Sharma, Senior Director Nursing, Max Healthcare, Dr. Nirja Sood, Assistant Professor, School of Health Sciences, IGNOU, Ms. Deepa, Head Nursing Services and Principal National Heart Institute, Ms. Jolly, Nursing Superintendent, W. Pratiksha Hospital. As we start, I would request our lead panelist, Colonel Binu Sharma, to let us know her opinion on a very important issue, that is, does the nursing empowerment impact high quality care in a hospital setting? Over to Dr. Binu Verma.
I also compliment all the esteemed speakers on this panel. Dr. Nirja from IGNOU, Deepa representing the National Heart Institute, the clinical part, as well as the education out there, Ms. Jolly from one of the OBG setup, W. Pratiksha, and myself from, again, a corporate sector. All of us represent quality in a different manner in the healthcare. And you're asking me about empowerment. I think if we all were not empowered enough, we would not be on this panel. Empowerment is not just showing your power or a designation or a rank. Empowerment in nursing directly leads to safe patient care, better patient outcomes, autonomy of the nursing function. Hence, having the ability to effectively motivate and mobilize yourself and other members of your team to accomplish positive outcomes in your day-to-day practice and in the work environment is what I will call empowerment for nursing.
Thank you so much, Dr. Binu. Actually, it is very heartening to hear, and also from a strong person like you, who has been always at the helms of affair of the nursing services everywhere, holding so many years of experience with you in the corporate sector. And actually, I totally very well said. Actually, the nurses, they are something like a pillar in every hospital setting. Wherever they are, they a strong leader, a strong empowered nurse will actually bring in positive outcomes wherever they are.
There are some institutions where nurses are empowered to take decisions, but you see, over and large, it is a big challenge for the nurses to take decisions. They are the crucial part of our health system, as Dr. Niru has also emphasized, seeing what people are doing and what are the deficiencies. But if you see the current scenario of the quality management, as per the evidence, it says it has to be defect prevention, continuous process improvement, and outcome improvement, which actually leads to patient satisfaction and patient safety. That is very important.
Nurses in the past as well as the present have exemplified themselves as great bedside nurses. And it has now challenged us. In the past also, there were a lot of challenges. Madam has already spoken about it. And we have overcome those challenges. So we have a continuum from birth to death. The first person who touches the life is a nurse, and the last person who touches the life is a nurse. So in that continuum, we have every point a nurse can work from that birth to death. Few things which we see in today's time. It is the best time for us to expand and wings and fly high to infection control, nurses, wound care, pain management, palliative care. Then we have rehabilitation, diabetes, education, which was, I think, even 2 decades back, nursing education in the hospital setup was not that large. And today it's a department by itself. So all these things have come because we have thought beyond the bedside. We have touched every point of our service area.
Every hospital, after building up a new hospital, every hospital goes for accreditation. And once after getting the accreditation, to sustain it is something important. And to sustain this accreditation or quality, to maintain the quality, the indicators are very important. So many hospitals are there, those who are looking only for some set quality indicators which are given from the NABH, like 32 indicators are there total, and this many are for the nursing, these are for the other departments, like that. But I'm of the opinion that as nurse leaders and as a quality nurse, we should have some our own quality indicators which we should select, and we have to monitor for our own improvement in our department, nursing department, according to the different hospitals.
Is nursing quality an end-to-end process, or is it just the dashboard compliance?
A mix of both would be better, because a dashboard is definitely required, because it would give you a track. It would not let anything of the quality parameters which are being set by the institution or by the accreditation body missed. The dashboard is important, but it should not function as a blinder for the horse.
Deepa has said the research and the evidence, I should say that percentage is also very, very less.
Minuscule.
Yes, it is 0.5%. I have personally done a study where the research skills, management, leadership skills are missing in nurses.
With that, Dr. Neeru, my question to you is, we all discussed nursing quality. So do you at Astron, after listening to us, do you think there is a need to design and devise and initiate a program to qualify nurses in a quality management program?
Now, coming to the question from Dr. Binu, now see, since we've been discussing the involvement of nurses is on the rise, whether it is implementing quality standards or CQI or digital technology, work culture, or communication skills. So at the end of the day, everything is converging to skilling and reskilling of our nurses. So we have kept a very, very broad-based approach at the Astron College, considering the industry needs, considering her personal needs, her personal availability. So at the e-college, we have tried to cater to the demands of the nursing professionals, and we have tried to bring in pre-recorded video-based sessions which have been designed by the industry experts, not only for the nurses, but for the healthcare, clinical management, non-medical fields, also the soft skills, where Dr. Binu said that communication skills are very, very important. So soft skills have been adequately catered to, and also looking at the burnouts and the pressures she has at her work, motivational programs are also there, can be skilled and reskilled. And in the first phase, initially, actually, this has already been launched. And in the first phase, in terms of nursing quality, we've actually launched a advanced certification in nursing quality management, which is just 3 modules, a course which is pre-recorded video based, and she can do it anytime. Lifetime access to the certificate is there, and she can complete the course anytime, whether in 2 hours, whether in 2 months, whether in 6 months. There is no binding to that. She can open anytime and do it. Assignments are there, very simple assignments are there. Immediate, the certification will be downloaded immediately. Accreditations are already there.